Hi, I'm Eric Chudler, a professor at the University of Washington. Today, I'm joined by Dr. Chet Moritz, who's a neuroscientist also at the University of Washington. Thanks for joining me today, Chet.
Thanks. It's great to be here, Eric.
So I was just wondering, how did you get interested in neuroscience?
That's a great question because when I was in school, there really wasn't something called neuroscience. At least there weren't neuroscience degrees. So I started out interested in something called biomechanics, which was this idea that we could use engineering to help understand biology. And I did that for my PhD. But then after that, the next most interesting questions were, well, how does the brain and the spinal cord control all those muscles and limbs that I was studying? So that started my interest in neuroscience.
When you were in high school, were you always interested in science, or did you have other interests when you were in high school?
Yeah, I liked science. I liked math, all the usual stuff, history. Didn't much care for writing and English, but the funny thing is now I do a lot of writing and wish I'd paid more attention in high school.
And then for undergraduate, where did you go?
I went to the University of Washington actually for my undergraduate, and I majored in what was then called zoology. It was before we had a biology program, and so the big joke was everybody said, "What are you going to do? Work in a zoo?" And I'm not working in a zoo now, but I do get to work with animals in some of our research.
And then after you graduated from the University of Washington, where did you go to graduate school?
Then I went to the University of California at Berkeley. They had this amazing program in biomechanics. There were about six different people studying the kind of things that I wanted to study. So that was a fantastic experience.
And now you're back at the University of Washington. So where are you? What department do you work in now?
Good question, because I'm in three departments right now. Since we don't have a neuroscience department, I have one joint appointment in what's called our physiology and biophysics department. That's about as close as we get to neuroscience. But I also have appointments in electrical and computer engineering, as well as a department called rehabilitation medicine, which is a clinical department in the School of Medicine.
And I know that you're also co-director of the Center for Neurotechnology with Dr. Raj Rao. Tell me a little bit about what's going on in the center now.
Yeah, it's really exciting times in the center because we've been working for just about 10 years to build devices and discover new ways to help heal the nervous system after brain injuries or spinal cord injuries. And we're now starting to test a lot of those ideas in human subjects, people who've had a stroke, people who've had a spinal cord injury, people who have Parkinson's disease or essential tremor. So it's really exciting. Many years of engineering and animal research has finally led us to the point where we can test these approaches in humans.
Wow. And what about in your own lab? What type of research are you doing in your lab?
Yeah, our lab focuses on spinal cord injuries specifically injuries to the neck part of the spinal cord that affects people's ability to use their hands. And so we study that in both animals, in rats and mice, but also in human subjects, volunteers who come in and let us stimulate their spinal cord and practice over and over again using their hands to try to make their hand function better.
And you've been seeing some good results. These people are really getting some benefit from these new techniques.
We have. We've worked with about nine people now total, and we've seen some really impressive results. Even people who were almost completely paralyzed for several years after their injury, they're starting to move their fingers again. And people who had a little bit of movement but had been injured for more than 10 years, they're even regaining the ability to do things like paint with a paintbrush on canvas or play a guitar. So it's really exciting for us.
Fascinating. And when do you think some of these things will be able to, people will be able to use in the clinic, or people might be able to buy these stimulators? Is this a long process? How does that actually work?
Typically it is. And when we work on devices that are implanted inside the body, we always say, oh, 10, 15, maybe even 20 years by the time the device gets all the safety testing and everything and is shown to be both safe and effective. We're actually working on some techniques right now where we stimulate the spinal cord even through the skin. And so that's let us move much faster to a multi-site clinical trial. And so we're actually doing a clinical trial right now, which is the last step before approval by the FDA if all goes well. And we're hoping to have that trial done in the next couple of years. And so it's possible even within 3 to 5 years, there might be a new stimulator available for people with spinal cord injury. And that's really fast in our field. It's usually several decades.
That's fantastic. Now, in addition to your research, you also do some teaching at the University of Washington. Is that right?
I do. Yeah, I really enjoy teaching. I teach neural engineering to undergraduates and grad students, a whole sequence of courses, both an introduction and a tech studio course, we call it, a team design class that's actually going on here just in a few minutes. And then I also teach the physical therapists. We have a graduate program, doctor of physical therapy program. And so I teach them neuroscience, exercise physiology, and then sometimes even anatomy.
Wow. You're so busy with the research and the teaching and with the Center for Neurotechnology. When you're not doing one of those things, what do you do in your off time? I know
Yeah.
that you live quite a distance away from the U, and I know that you ride your bike a lot. Is that true?
Yeah, I love being outside, and so I turned my what would have been a 45-minute commute in traffic into a bike commute. So I get to ride my bike along the Burke-Gilman Trail. That's a lot of fun. And then on the weekends, I like taking the kids out, maybe going mountain biking or skiing or hiking, just something to get outside and get some fresh air.
Yeah. Now, what about in the winter? I mean, in Seattle, it rains a lot. Do you still ride your bike in the rain and the sleet?
Yep, year round, just have all the rain gear and change on each end, and then even have those metal studded snow tires for my bike so I can ride in the ice and the snow. But it's kind of miserable. I'm not sure I'd recommend it, but it's better than sitting in traffic.
Yeah. Well, great. Thanks for taking time to talk to me, Chet. I'll let you get back to your students. So again, thanks for joining me today.
Awesome. You're welcome, Eric. Take care.